Okay, well, I'm gonna talk about ADHD. So let's get started. So, what is ADHD? ADHD what it is attention deficit hyperactive disorder, and it's a condition that makes it hard for children to pay attention and control their behavior. There's three types of ADHD: inattention, which is when a person wanders off task, lacks persistency, has difficulty sustaining focus, or being disorganized. That these problems are not due to defiance or lack of comprehension. Then there's hyperactivity, which means uh, for a person to move about constantly, including in situations in which it's not appropriate, or excessively fidgeting, tapping, or talks. In adults, it may be extreme restlessness or wearing others out, but with the constant activity that they're doing, like moving around and stuff. Then there's impulsive, which is when a person makes hasty actions that occur in the moment without first thinking about what they're doing, and they have high potential of harming the people around them or maybe even themselves. A desire for immediate rewards or inability to delay gratification. An impulsive person may be socially intrusive and excessively interrupt others to make important decisions without considering the long-term consequences. Um, so obviously ADHD gets in the way of learning, so you can't absorb information or get your work done if you're running around the classroom or zoning out while you're at work, um, or when you're supposed to be reading or doing chores or listening to people. Um, so thinking of that, what's the cause of ADHD? So some theories or um, uh, some theories or causes of ADHD are genes. We all know what genes those are, and then things that the mom does while they are pregnant. So like smoking, drinking, doing drugs, things like that that you obviously shouldn't be doing anyways while you're pregnant. But also exposure to toxins in the environment, maybe even like what you eat. Then there's also brain injuries. Um, it is normal to have some inattention, unfocused motor activity, and impulsivity, but for people with ADHD, these behaviors are more severe, occur more often, and ADHD is more common in males than females. And females with ADHD are more likely to have problems primarily with inattention. Other condition other conditions such as uh, learning disabilities, anxiety, depression, um, disorder, substance abuse are common in people with ADHD. Treatments. So, under medical supervision, stimulants are a good medication for people with ADHD to have because they are considered safe. However, there are risks and side effects to the stimulants, especially when misused or taken in excess of the prescribed dose. So, for example, stimulants can raise blood pressure and heart rate and increase anxiety. Therefore, a person with other health problems, including like high blood pressure, heart disease, liver or kidney disease, they should tell their doctor before taking the stimulants. Then there's non-stimulants, which a few ADHD kids, adults use. These medications take longer to start working, or you can see the effect of them, but they can also improve your focus, attention, and impulsivity in a person with ADHD. Doctors may prescribe a non stimulant when a person has bothersome side effects, from the stimulants that they used. When a stimulant was not effective, or in combination with a stimulant to increase effectiveness. Then there's psychotherapy. Um, a form of psychotherapy is behavioral therapy, which, like it says, it deals with your behaviors. So um, it's aimed towards people who have changed his or her have changes in his or her behavior. Sorry, it might involve practical assistance such as um, helping you organize while you do your tasks, or completing homework, working through emotionally difficult events, things like that. Then there's family and marital therapy, which helps the family members or the spouse find better ways to cope or handle disruptive behaviors, to encourage behavior changes and improve interactions with the patient or their child. How many in the US? So, like it says, um, about 6.1 billion kids between the ages of 2 and 17 years old have been diagnosed with ADHD in 2016. I couldn't find how many are now, or like even last year, but I'm assuming it's around that percentage. The percent of children estimated to have ADHD has changed over time, and its measurements can vary. And you'll see that in the next slide. But the American Psychiatric Association states in the Diagnostic and Statistical Manual of Mental Disorders that 5% of children have ADHD. However, other studies in the US have estimated higher rates in the community samples that they've done. And like I said, here's a graph of um, from 2013 to 2016, the number of kids who've had ADHD. And obviously you can see that the, I mean, obviously it does vary, but it's pretty much in the same range of being between 400 and 6.5. So, yep. Do students demonstrate the same characteristics? No, obviously not. Not all students demonstrate the same behaviors and characteristics. There, I mean, obviously, not two people aren't really the same unless you're twins. But there are students that don't need to be placed in special education, but they do need special accommodations in regular classrooms. So obviously, all students have different learning, different ways of how to learn, and you're gonna have to uh, learn how to teach each student with behavioral issues or characteristics, and just kind of sample those out. And I will give some examples of that too. So yeah. What category is ADHD in? ADHD students were categorized under the category of other health impairments, but was not identified as a distinct category of its own. So I feel like it's just kind of out there in the health impairments. And then the effective class-wide interventions. So classroom interventions for the student with ADHD should be based upon a solid foundation of general behavior intervention principles, like instructional considerations. So these are the examples I was talking about. So task duration, to accommodate to the student's short attention span, lack of focus. Academic assignments should be brief, and feedback regarding accuracy immediately. Longer projects should be broken up into different parts so they can manage it better and learn it, process it more. And short time limits for task completion should be specified and can be enforced with timers. Direct instruction is another example. Attention to task is improved when the student with ADHD is engaged in teacher direct as opposed to independent seat work for them. So this is one where you should be with be with the students and making sure that they understand it and having that feedback. Also, the teaching of note-taking strategies increase with the benefits of direct instruction. So, then there is distractions, which generally research has not supported the effectiveness of complete elimination of all irrelevant stimuli from the student's environment. However, as these students have difficulty paying attention to begin with, it is important that attractive alternatives to the task at hand be minimalized. For example, activity centers, mobiles, even going to like aquariums, should not be placed within the student's visual field. So, and that's all I have for you. There's a lot more: scheduling, organization, peer tutoring. There's a lot out there. So just kind of go with how you feel and how the situation is. But that's all I have. Thank you. Here are my citing my sources. That's all.